Hi, my name's Sam Dobson, tubal surgeon. I just wanted to do a really short video on post-tubal ligation syndrome, what it is, how you diagnose it, why it might happen, and what we can do about it. So post-tubal ligation syndrome is the onset of some new symptoms like bloating, pelvic pain, heavy periods, painful periods, pain with intercourse, tiredness, skin changes, rashes, sensitivities, hair loss, a great range of symptoms. But the key thing is that they start after sterilisation, and that can be after clip sterilisation or it can be after cut and tie sterilisation. So we're not really sure because there's not a lot of research into it and there's not a lot of published data either. But we think that post-tubal ligation syndrome might be something to do with a disruption to the nerves and the blood vessels that go along the tubes when they're cut or clipped. And this disruption in blood supply affects the ovary, the womb, and also the hormones produced, which then results in potentially some of the symptoms. The other thing is that by putting clips on the tubes, for some people that causes pain, and also rarely, but some people may react to the metal used in the clips, but we think this is probably very uncommon. Well, the key thing really is to work out, when did it start? Did these symptoms start when you were sterilised, straight after, or did you have them beforehand following birth, and then they've just got a bit worse with time? If they started when you were sterilised, then there's a much higher chance that they are related to the clips. Well, the first thing is to think about the symptoms and whether or not they can be controlled with a hormone contraceptive tablet or a Mirena coil. And if you've tried things like that and you've been examined and perhaps had an ultrasound as there's no obvious cause found for the pain and the symptoms you're having, then it is worth considering whether or not removing the clips and putting the tubes back together in a reversal procedure is worth doing. So with a reversal of sterilisation for post-tubal ligation syndrome, again, there's not a lot of data in the literature out there that's published, but I've been collecting my results and in addition to the results of Mr. Pickles, and we've found about 92% of our patients are either symptom-free or vastly better after reversal surgery, where we've either removed the clips and put the tubes back together or just repaired the tubes if there was a cut and tie.